I'm very interested in screening and early detection of malignancies of the GI tract. So the GI tract is probably the most common site for tumors to form, and that includes the esophagus, the stomach, large intestine, pancreas, and liver. There are a number of very effective screening strategies and early detection strategies for many of these tumor types. However, there are still many deficiencies, and there are many areas in which we don't do as good a job as screening as we could. And there certainly is a problem in terms of access and delivery of many of these screening modalities. Screening and early detection are really the keys to reducing the morbidity and mortality associated with a number of these GI cancers. We have a particular interest in the group of patients who are what we call high risk, and these are individuals who typically have a strong hereditary or genetic predisposition to malignancy. Part of the problem is that people are not aware entirely of who should be screened and who actually belongs in that high risk category. We've been very interested in looking at different types of approaches to identifying these high-risk individuals. Some of these include taking a universal approach, meaning just screening everyone who has a particular type of cancer. Some of these have entailed using more electronic approaches where we're able to comb through the medical record to identify individuals who meet certain clinical criteria. But the other aspect is that we've begun to look at how can we best offer genetic services. Genetic counseling and testing is critical because it can identify those who require more intensive surveillance, and it also has huge implications for family members because it does mean additional family members will be at risk and they may not be aware that they all are at risk for these particular malignancies. Within established screening techniques, so colon cancer, for example, is one of the most common malignancies that we screen for. There are a variety of effective techniques, such as screening stool for occult blood or performing colonoscopies. However, these modalities are not perfect, and we're interested in learning about ways to actually enhance the quality of these particular techniques that are well established. And one of the projects we're looking at is using artificial intelligence to help us during the colonoscopy process so that there may be mechanisms that can be built in that can actually identify lesions, polyps of interest during the procedure that the endoscopist may or may not recognize. And AI certainly has the potential to help us improve detection rates of during colonoscopy, which are not perfect at this time.